I know what you've done. You've counted calories, eaten tons of protein, you've increased your fiber, which caused constipation, you've tried apple cider vinegar, you've tried fat burners, more cardio, juice cleanses, attempted a ketogenic diet, waist trainers. Who am I kidding? You have done a lot of things to try and get rid of your belly fat. I understand. I have too. But there are some things I'm guessing you have not tried, including the number one thing that is really important for reducing belly fat. And that's what we're going to talk about today. But before we dive into all things belly fat, I want to introduce myself. Salam and hello. My name is Khadija, and I am a pharmacist based in the United States. And I help women who are on their peri to postmenopausal journey focus on prioritizing their health, their well-being, and their vitality with proven health approaches and solutions. If this is something that is of interest to you, I encourage you to keep watching and don't forget to subscribe. So after watching this particular video by Dr. Mindy, a chiropractor based in the United States, it's obvious that we have a lot of proven solutions to help us get rid of that unwanted and stubborn belly fat that many of us women, whether we're 35, 40, 45, experience. Dr. Mindy, she hit on highly researched, scientifically backed data that includes intermittent fasting, high protein, perhaps a ketogenic diet, not every day of the week or every day of the month, but thinking about that, and also doing exercise and eliminating fast food from your diet. And we get it, we understand it, but the question still pegs many of us is, why hasn't it worked yet? Or why isn't it working if I'm in the middle of doing all of these things? So what I'm going to attempt to do is I'm going to go into some topics, ideas, and thoughts that we may be missing and misunderstanding, and the role that it plays and why we have this stubborn belly fat. And that includes looking at structural changes that have occurred with our bodies, some other underlying issues that don't have anything to do with food or exercise. So let's dive in. So the first thing I want to talk about is diastasis recti. Diastasis recti is the increased distance between the rectus abdominis muscles and the midline that causes a lot of weakness in women who majority have had children. And so if you've had 1, 2, or 3, you'll notice that the muscles in your abdomen have separated. The best way to determine if you have the separation of the abdomen is to lie flat on your back with your shoulders down, hips down, preferably with your knees bent, and you'll take your fingers to your belly button, 1, 2, or 3, and you'll slowly tilt your head forward. Not completely moving your shoulders off the ground, but enough to where you can actually feel in your belly button, and it will tell you the distance or the severity of your diastasis recti. Something like a 4-finger width or distance between the rectus abdominal muscles, it's serious, it's severe. Where 1 is perhaps somebody who's been able to recover after childbirth. So these are some things to think about, because I too have had this particular condition, and I've tried rehab once. Exercise has seemed to help a little bit, but it's going to take a lot of conditioning and a lot of core focus or core exercises to bring the abdominal muscles back together. I don't know if you've ever noticed that when you're exercising or you're lifting weights, you might have some protrusion of your abdomen, or even after you've eaten, you find yourself extremely bloated, or you're having a stomach that's distended more than usual. This could be one of the reasons. And when I say structural issues, this is what I'm talking about. You'll have to identify the structural issues that are going on within your abdomen that might be leading to you thinking you have belly fat or excess belly fat. It's kind of exacerbating the situation. So that's something you're going to want to look into and investigate if this is something you're experiencing, so that you too can rehab and get better and heal your diastasis recti. The second thing on the list I want to talk about is stress. Who is stressing you out? What is stressing you out? Why aren't you sleeping well? What are your cortisol levels look like? Now, cortisol, you can go to the lab and get your cortisol levels checked, or you can do a home urine or saliva test. But cortisol is crucial because it is your stress hormone. High cortisol can cause belly fat or fat around the midsection. It's also responsible for causing mood swings, irregular periods, as well as swelling in your limbs. That's what usually occurs when you have high cortisol. That's what's presented clinically in patients who have high cortisol levels. On top of hormonal changes that women experience with their estrogen and progesterone as they age, this kind of exacerbates everything that's going on with our body. So it's going to be important for us to determine if we have high cortisol levels and what we can do to mitigate that. Now, on the flip side, low cortisol can also cause weakness and fatigue. So that's something you're going to want to really pay attention to in terms of how to manage stress, how to alleviate stress from your life, what you're going through, whether it's work or people or environment or situations. So number 3 on the list is blood work. So I have a question for you all. When was the last time you had your labs taken? Specifically your A1C, your blood glucose, your thyroid levels. So let's talk about why you should get routine testing. When I say routine, perhaps yearly, or if you're not feeling well, or if you need to have checkups, you need to have frequent visits to get these things checked. So insulin, for example, is a hormone that's responsible for pulling glucose out of the bloodstream and storing it into fat, your adipose tissues, or your muscles to use them when they're really necessary, to use the glucose when it's absolutely necessary to use the glucose. If glucose is floating around within your bloodstream, it leads to diabetes, obesity, weight gain, belly fat. So in order for you to figure out what is going on within your body, it's going to be necessary for you to go in to get some lab work done. Additionally, you want to get your thyroid hormone checked and your cortisol levels, as I mentioned before, because that can show you, again, what is going on within your body in terms of your stress levels. Hormone imbalances have multiple signs and symptoms, and without knowing the actual values of what's going on with your hormones, those that can be detected and are often detected well enough, it's going to be difficult to pinpoint what's really going on within your body. So now that we've talked about diastasis recti, including blood work to test your cortisol levels and insulin levels, I want to talk about the number one thing that you may not be doing in order to get rid of your belly fat, even when you have corrected the hormone and the structural issues going on with your body. And the number one thing is consistency. Hear me out. I know many of you watching have tried to implement different things in terms of fixing your nutrition and fixing your physical fitness. And I congratulate you on that. But I do have to ask you, how consistent were you? Was it 3 months, 6 months, a year? How was everything going as you were trying these new routines in your life? Did you fall off the wagon and have to jump back on? Were there other extenuating circumstances in your life that caused you to kind of lose focus and lose sight of things? And how diligent are you in watching everything you eat? It can become a bit of a burden sometimes, but if you get into the habit of eating well and monitoring everything you're eating, it becomes less and less stressful for you, less and less burdensome for you. Your focus is not always on the food. If you have a set schedule, routine, you know what you're going to eat, you know what's going in, you know what's going out, you know, you've been able to kind of get into a system that works for you and your health. So consistency in doing all the things necessary to get rid of belly fat and become healthy is what's really going to push you forward. And it may not be that you see the results in 6 months to a year. It might take a year and a half, 2 years, 3 years to really get to the center of where you want to be. And that's okay. As long as you stay focused and you stay on the right track and you address all and any underlying health concerns and issues that you're going through. And you know, I get it. You might be saying to yourself, nobody has time for all of that. That's too much work to keep track of my nutrition and my diet, along with all the other things that are going on in my life, including taking care of my work responsibilities or my business or my children or my aging parents. I understand 100%, but make sure you understand that your body is your primary home. It goes with you everywhere. So I implore you and I encourage you to please take a moment to pause and reflect and prepare how you're going to make these changes so that you can remain consistent and getting yourself better and getting rid of this stubborn belly fat, getting your blood glucose in order and check, you know, making sure your thyroid is good, your cortisol is good, your hormones are balanced. A lot of things going on, including, you know, not only just the physical health, not the internal and external physical health, but also your mental health. You're going to need to take some time to reflect and do what you can to make sure you are doing well and that you're having the best outcomes possible for yourself. So I'm going to encourage you to continue to investigate your body, do some research, eliminate stress from your life, eliminate these toxins, reduce inflammation, and also check out this video where I talk about the 4 key areas of wellness that you should be considering or that you should really be focusing on. Don't delay, especially if you're between the ages of like 35, 40, 45, 50. If you're in that peri to postmenopausal or peri to menopausal age range, I encourage you to watch this video. Thank you for watching and see you in the next one.